Freud was born May 6, 1856 in Freiburg, Moravia, part of the Czech Republic, as Sigismund Freud, changing his name to Sigmund at the age of 22. In 1865, he was admitted to a secondary school, gymnasium, a year ahead of his time, graduating in 1873, receiving a summa cum laude. He attended Vienna University to start his studies as a medical student. In 1876, Freud started his first personal research on sexual glands of Anguillas in Trieste. After conducting his research, Freud served a year in the military in 1880. In 1881, he received his doctorate's degree from Vienna University. In 1883, Freud joined a psychiatric hospital under Meynert's service. In 1884, Freud discovered the properties of cocaine and therefore used cocaine as a stimulus to help manage his depression, achieve a state of well-being, and relax under tense circumstances. There were medical advantages of cocaine for Freud, with his research on the impact of cocaine on medicine, specifically on minor surgery. His research was published in Vienna Magazine on cocaine. Freud started self-analysis in the mid-1890s, climaxing in 1895 and 1900. His findings were published in The Interpretation of Dreams and The Psychopathology of Everyday Life. Freud asserted that dreams are disguised fulfillment of unconscious wishes. Freud used dream analysis as a psychotherapeutic technique that he thought uncovered unconscious conflicts. Freud overruled the difference between pathology and health, and proving that neurotic features are present not only in sickness but in health. He used free association as a psychotherapeutic technique, where the patient says whatever comes to mind. Freud differentiated introspection and free association, by that introspection does nothing else but reintegrate us into the level of our social values, and self-analysis offers us the opportunity of a radical change in our inner and outer being, from the perspective of a reevaluation of these social values. Freud believed that people always have a reason for saying something. He called these Freudian slips, which are defined as acts in forgetting or lapse in speech, and are unconscious motives and anxieties coming out. What might seem a slip of the tongue is actually real unacknowledged motives.
Freud thought there were different levels of personality determining the unconscious and conscious distinctions consisting of the id, ego, and superego. The id is the source of psychic energy, an aspect of personality dealing with instincts, including sexual and aggressive instincts. The ego is the rational aspect of personality that controls the instincts, and the superego deals with the moral aspect of personality, which is derived from internalizing parental and societal values and standards. Freud was convinced that his patients' neurotic disturbances originated in their childhood experiences. He was one of the first theorists to emphasize the importance of child development. He thought that adult personalities were completely formed by age 5. The first stage of the child development includes the oral stage. The oral stage is from birth to 2 years, and this stage involves stimulation of the mouth, which includes sucking, biting, and swallowing, as the primary source of sensual satisfaction. When you are stuck in this stage, Freud believed you would show such mouth habits, including smoking, kissing, or eating, or excessive optimism, sarcasm, and cynicism. The second stage is the anal stage, where children derive pleasure from the anal area of the body, coinciding with toilet training. If you are stuck in this stage as an adult, Freud believed you could become one of the following: anal expulsive or anal retentive. Anal expulsive includes dirty, wasteful, and extravagant habits. Or the opposite, anal retentive, obsessively neat, clean, and compulsive habits. The third stage is the phallic stage, which is around the age of 4 years. This stage deals with the neurotic satisfaction involving sexual fantasies and fondling of the genitals. Within the phallic stage, Freud discovered the Oedipus complex in that he found the phenomenon of being in love with my mother and jealous of my father, and now I consider it a universal event in early childhood. During this stage, children become sexually attracted to the parent of the opposite sex and fear the parent of the same sex. The final stage, the latency stage, occurs from 5 to 12 years of age. The onset of puberty signals the beginning of the genital stage. At this stage, the individual prepares for marriage and parenthood. Many of Freud's followers deviated from his theories and branched out to what we know as NeoFreudian psychology.
NeoFreudians were psychologists who agreed with Freud and his psychoanalytic theory. They changed the theory to modify it and incorporate their own beliefs and ideas into the theory. The points of which they agreed with Freud on were the unconscious mind, early childhood experiences, anxiety, and defense mechanisms. The points of which were adapted were the increased emphasis on adulthood, ego functions, and on constructive behavior. The NeoFreudians also thought that there was too much significance on sex and did not agree with the Oedipal complex or the phallic stage. They also did not favor the id theory and preferred the ego psychology more. They thought that the ego worked to try and make sense of one's own life experiences in the conscious thought. The NeoFreudians also did not like the idea of Freud only paying attention to the childhood experiences. They thought that most of one's life was spent interacting with adults, so that should be more important in the life cycle. Some of the important NeoFreudians include Alfred Adler, Erik Erikson, Karen Horney, Erich Fromm, Anna Freud, and Carl Jung.
Carl Jung was born on July 26, 1875, and died June 6, 1961. Jung was a neo-Freudian who proposed the idea of the collective unconscious, personality archetypes, and paved the way for the Myers-Briggs Type Indicator personality test. The MBTI was built from Jung's ideas of introversion versus extroversion, thinking versus feeling, and sensing versus intuiting. It was later addended to include judging versus perceiving. As a child, Jung was described as asocial. He didn't trust anyone and preferred to observe people or live in dream worlds. As he grew older, he began to work in psychology and eventually published a paper on word association. He wound up mailing this paper to Freud, who met with him the following year. Freud began to treat Jung as his foremost apprentice, more like a son than a friend, and afforded him every assistance he could, including getting him elected as chairman of the International Psychoanalytical Association. Jung and Freud would remain amazingly close friends until about 1912, at which point they had a disagreement that some would compare to a lover's quarrel. After the separation from Freud, Jung became a very private and isolated person who began publishing articles that began to dissent from Freud's views. Most of these articles were based on the ideas of the unconscious or the libido, with Jung feeling Freud's views on such topics were limited and negative. Jung's relationship with Freud was one that ranged from being as intimate as a father and son to complete academic opponents of the other's theory. Carl Jung did much work on dream analysis. He began this as a child and listened to dreams in adolescence, using his dreams as a guidepost for what his subconscious mind wanted to tell him. In his later life, Jung experienced some sort of psychosis and documented the experience in a red-bound book. He claimed that the experience was valuable and induced hallucinations to further experience it. Jung never published the Red Book, but eventually it was released for publication by his grandson, who was in charge of the Jung archives. Jung's theory of the collective unconscious is the idea that at the deepest level of our unconscious minds, we have a set of memories that are built from the experiences of our ancestors from previous generations. Jung's personality archetypes were the self, which contains a personality, the shadow, which is the more base, bestial, and creative part of the personality, persona, our mask to society, and the anima or animus, which is the masculine or feminine side of a man or woman, respectively.
Another important neo-Freudian is Alfred Adler. Alfred Adler, born February 7, 1870 in Austria, was an important part of the neo-Freudian movement. He is best known for being the founder of individual psychology. He is also given the title of one of the most influential forces on the subject of modern psychology. Growing up, Adler suffered illness very often. Growing up, because of his struggles, he longed to be a doctor someday. Because of his struggles, he longed to be a doctor someday, so he could help others with illness. He earned his medical degree from the University of Vienna in 1895. During his time as a physician, he studied how disabilities affected one's personality and self-image. However, in 1902, Adler read Freud's book on dream interpretation and responded with positive interest. Because of his interest, Adler was invited to participate in Freud's weekly discussion group on the advancement of psychology. However, Adler was very interested in treating his patients as a whole person and not just in parts, which was very contradictory of Freud's views on separating a person into parts or concepts like the id, ego, and superego. These disagreements caused Adler to part ways with Freud's school of thought in 1911, taking several members of the Freudian school with him. In 1912, he published The Neurotic Constitution, in which he introduced the idea of individual psychology. Adler thought that the individual was the smallest unit for study in psychology, rather than being capable of breaking things down to id, superego, ego, etc. He was interested in the individual's functionality and how it related to groups of individuals, such as coworkers, community members, and so on. Because Adler's theories were so closely related to daily life and real experiences for individuals instead of being focused on sexual drives and impulses like Freud, his methodology was found wide acceptance and continues to influence modern psychology today. His ideas can be seen in the works of Erich Fromm, Abraham Maslow, Rollo May, Karen Horney, Julian Roeder, E.C. Tolman, and Carl Rogers. It is fair to say that Freud and the NeoFreudians left a profound mark on the timeline and history of psychology.